to call upon. I wish to call upon our Nupsa chair, Sharon Mujiza, to say something before we start the meeting.
Thank you, Prof. So my name is Mugisha Shannon, trainer. I'm the chairperson, Nupsa. I would like to start by thanking you, Prof, and the speakers, Dr. Dev and Dr. Jerusha, for making time in your busy schedules to come and mentor us. Yes, I'd also like to thank the students for making time, and I hope this will be very fruitful and I hope we really learn a lot. Yes.
Shannon, it would be good if you could show your face.
Okay, right now is we have just gotten to the PSK event in Mombasa. So right now is right. Okay, but let me show my video. Let's see. Okay, I think that's good.
Okay, thank you. It's good for everybody to know who you are. Yes. Okay, so let me start first by introducing our guests. So I chose them carefully because they are achievers. So in front of you, you have achievers. So we say ladies first. So I wish to introduce I wish to introduce my friend, Dr. Jerusha Kamau. We were classmates, and currently she's one of the managing directors of JFlex. She's a pharmacist. She trained in the University of Nairobi. She holds a master's in entrepreneurship from Jomo Kenyatta University. So currently, so I want to challenge all of you that you're never too old for anything. Now she's pursuing her second master's. So you know she'll be a double master's holder from now a university in Europe. She will give you more details. So I called her so that you can all be challenged that no matter how old or young you are, it's not too late to pursue your dreams. She's a very successful entrepreneur. So she'll tell you more about herself. So Dr. Jerusha, oh, I forgot to turn on my video. So Dr. Jerusha Kamau, welcome. Our young professional pharmacists. Okay. I want to Dr. Dave Nahil. So Dr. Dave, please, I would appreciate if could show us your face. Okay. Dr. Nahil, please.
So that you can see it.
Yeah, I need to see your face. Thank you. Thanks. Yeah, I can see your face. Everybody needs to see you of your video. Okay, so yeah, so allow me to introduce Dr. Nahil. Again, he was my classmate. He's a prominent pharmacist. He's in retail. I wanted to invite him so that you can see if you open your retail pharmacy, what can you do to stand out and to differentiate yourself? So he's a vaccinologist. On top of that, he won an award from Johnson for being the most innovative pharmacist. So he'll tell us more about that award. Okay. So I selected these two deliberately to inspire people. These days, we don't, these days, jobs are scarce. Does that mean that you should give up? No. There's a career path, and that career path is innovation and entrepreneurship. So I want them to share their life experiences and to give everybody advice. And from their life experiences, you stand to learn a lot. Okay, so before we dive in, I want to invite the patron of Nupsa to say a few comments. So Dr. Stanley, Professor Stanley Ndwiga, the floor is yours. So kindly say a few words.
I missed something, Prof. I'm happy to be here. I don't know what to say, but Nahil Daver is somebody I've known for a long time. He was learning for office in Nupsa when I was a last year. I don't know, is he on, Dr. Nahil Daver? But anyway, it's good to have these talks as we organize the celebrations of pharmacy at 50 years training in Kenya. And at the same time, as we think about what to empower our young pharmacists, is a very, very good thing. What you're doing, Provocarable. And okay, I'm the chairman of Pharmacy at 5th Steering Committee for University of Nairobi School of Pharmacy. And for the ones who have been very, very bad that we are downgraded, we still call ourselves a School of Pharmacy. As a profession, we need to grow. We need to get inspired. We need to think about things beyond the things we teach in pharmacy. And I think that's why you are bringing Dr. Irundave, you are bringing the JFREX. This is called Dr. Kamau. Come also to speak to us and mentor our students. So, Faith, thank you for this initiative. And I hope that our students and even the alumni as a whole, we learn from the experiences of our seniors. Nahil Ndave was my senior. Even JFREX, Dr. Kamau is also my senior. And even you, from Okalabu, you are my senior. You taught me. They may not know that you taught me, and you are a good lecturer to me. So thanks for giving this chance. Me is just to encourage that our students feel encouraged in this year when they are hearing that there are no jobs. Even lawyers are here, there are no jobs, doctors, there are no jobs, but we can re-engineer and keep on I think it's re-engineering our pharmacy course so that we can become better, perform better, and become even great careers for our students. Thank you, Prof. Karebro. Back to you.
Can't hear you, Faith.
Prof, you're muted.
Oh, okay. Thank you. So thank you
Yes.
for all those remarks. I don't want to waste time, and I wish now we'll start with the ladies. We always have to start with the ladies. So I wish to invite Dr. Jerusha Kamau to tell us a bit about herself and to tell us about entrepreneurship and her entrepreneuring journey. So she is not employed. None of the people who I've invited here are employed, but they are employers. So Dr. Kamau, please take the floor.
Good evening. Thank you, Professor Okalebo. Thank you, Dr. Ndwiga, for that remarks. And thank you, students, for making time this evening to come and let us share our experiences with you. And as Prof has said, people out here are saying there are no jobs for pharmacists. And so we are here to tell you there are jobs, because jobs is not just about being employed. My name is Dr. Jerusha Kamau, and as Prof has said, I'm a pharmacist. by training, and the lead consultant and founder of GFlex Consultant. I also have a Master's of Science in Entrepreneurship from Jomo Kenyatta JKUAT. You know, when I went back to do my Master's, people asked me, oh, you're doing Master's in pharmacy? I told them, no, I'm not doing Master's in pharmacy. So what are you doing? They were like, what else are you doing? And I told them, yes, I want to learn about entrepreneurship. Why? We are going to look at it. Why I decided to do the entrepreneurship as a course, and it is because I needed to know how businesses are done. And after that, as I continued, I realized, oh, there is no end to learning. And right now, as Prof said, I'm a student taking a master's in pharmacovigilance and pharmacoepidemiology. So we are just going to move together. This is not really a lesson, but discussion of what we need to do as pharmacists to make it. You know, when we go to pharmacists, we are usually very, very, very positive. We are some of the best brains in the country, and we know we are bright. So we need to use that knowledge to make it in life. We don't want pharmacists to be miserable. Something small about myself. I graduated from the University of Nairobi in 1993, and I did my internship in 1994. And from there, as usual, as any other young pharmacist, I went into employment. It's not wrong to be employed. So I was employed for about 4 years. And from there, I engaged in my journey as an entrepreneur by first of all running a practice in the community pharmacy for about 14 years. And after that, I again decided to take it further and opened a consultancy in regulatory affairs and pharmacovigilance from 2014. And that's what I am doing right now. Again, we are going to look at how are we going to be resilient in this career life, because like I can assure you, when I decided to do the regulatory affairs, I almost needed to go back for internship. And so life is about learning new skills, equipping ourselves with the skills that we require. It is asking us for. For a pharmacist graduate, possibly we need to look at what it is entrepreneurship, so that we get to know what entrepreneurship is, and then we need to look at how do we become entrepreneurs as pharmacists. So we have many definitions. We have many definitions of entrepreneurship, but I really like what I got here. It's a process of discovering new ways of combining resources. So you have resources that you are going to combine. And as we are going to sources, it's not just about the pharmacy skill or knowledge that you are going to get from the University of Nairobi. That is very, very important. But we need to look at what other resources do we need and be very intentional about getting those resources. Again, it's about discovering new ways of doing things. Because in entrepreneurship, if you're going to do things that everybody else is doing, as Daffy is going to tell us. Sorry?
So Clement Orwa, please mute. Clement Orwa, please mute. You may continue.
Okay, thank you. So as I was saying, entrepreneurship is just about getting new ways of meeting the needs of the society. And as pharmacists, as experts in medicine, there are so many ways that we can serve the society. It's for us to be explorative. It's for us to look at what can we do for the community. So we say entrepreneurship is indeed in the journey of opportunities, exploration, and risk management. And by doing that, we are going to create value and for profit. So
Penina, please mute. Penina. Okay. Penina, please mute. Okay, Dr. Kamau, please continue. Sorry for those interruptions. Yeah. Sorry, we can't hear you. Sorry, we can't hear you. Daktari, we can't hear you.
And now? Yes.
We can hear you now. Yeah.
Okay.
Okay,
Sorry.
thank you.
Okay, thank you. So Shumta, who is a guru in entrepreneurship, described an entrepreneur as a force of creative destruction, overturning the old established ways of doing things and replacing that with new and better ways. Remember, we are just always going talking about new and better ways. How are we going to put our practice in better ways than what has been there before? And that is what get his innovation award. So an entrepreneur creates goods and products and services by making decisions about the coordination of those resources and by adding value. So now that we know what an entrepreneur is, and we know what entrepreneurship is all about, we will look at how do we move from employment to entrepreneurship. And maybe from also, we are going to look at, supposing I'm not employed, then what can I do from there? So I have a table here, which depicts how many entrepreneurs move. Many entrepreneurs will move from being employed to being a business owner. This is a path that many pharmacists go through, or from being self-employed to being a business owner. And so as a pharmacist,
Okay, I'm muted again.
what's happening? Because I'm not muting from my side. Sorry.
Okay.
So we are going to look at about that. So we'll learn about the entrepreneurship and the critical success factors in business. Because what we are going to look at is that if you want to be an entrepreneur, then it means apart from the skills that you get from in the pharmacy, you also need to have business skills. And you look at, how do I get these business skills? Do I go back to school? Do I look for mentorship programs? Do I go for apprenticeship? Maybe I ask David, can I come and just work in your pharmacy as I learn these skills? This is how we are going to learn how to become successful entrepreneurs. So what are the different paths that we can take as pharmacists? We already know, most of us knows about the community pharmacy, whereby we go and we start our retail and wholesale pharmacy. It's a very good practice. And if you are in that space and you are professional and you offer unique services, as our colleague will tell us, it is a good way of starting. But there are areas that you can explore. You can go into consultancy. You can do consultancy in medication management and services. You can offer regulatory services like I'm doing. You can do regulatory services. You can go into quality assurance. You can do medical writing. We have some very bright minds here who can do a lot of very good writing. There is a lot of things you can do in the space of e-health. So we just need to have our eyes opened and our minds opened so that we are receptive ideas, and once you decide this is the space that I want to play in, the next question is, then what do I need to do to succeed here? Sometimes we have seen some professionals just starting a practice, and in business we say that if you only have the technical skills, then you are not likely to go very far, because there are other very critical skills that you need to be able to succeed as an entrepreneur. So as young pharmacists, what am I saying is that even as we step out, we need to look at what do we need to do to enhance what we already have, not just even for our own businesses, but even where we go and work. What is the unique value that we are going to take there? We talk about entrepreneurship, and we are going to look at another one called intrapreneurship. if you go to in a business, you need to exhibit that entrepreneurship attitude, work in that work like it is your business. So are you being, are you giving ways of doing things? Are you making that business more efficient? Going to take forward to your business when you start. And so in entrepreneurship, we say we have many factors of production, as I have said, and we are going to go through those very quickly. We have factors like in the premise, you need very skilled human resource. Of course, you need capital. Sometimes we think a lot of capital is what translates into new businesses, and some of us found, no, you know, we don't have money. It's only the business people with a lot of money who can do this. And so we find ourselves getting compromised because we find that, like, when we go to work for a business person, we think that they have a lot of money. And so if we get somebody who is not very professional, they can really make us do maybe things which are not ethical. But when you go to work in a place, you just need to realize that you are, as a human resource person, you are playing a very critical role, and the entrepreneur has the capital. And so all these factors are being brought together to make a very good enterprise. And you learn from it and you say, okay, this is what I'm gonna do even when I start my own enterprise. So you can learn from where you are working by doing the right things, by being ethical. So you exit to your enterprise, then you are going to become a very good entrepreneur. Of course, entrepreneurship is, as I said, is a very important factor of production and the knowledge that we require. And as I said again, knowledge is not just about the technical skills that we get from the School of Pharmacy. If we want to become entrepreneurs, we need other very important skills, the technical skills, the conceptual skills, being open-minded and knowing, going out of your way to know very many things. You need leadership skills. And all these skills you can actually get by not just going to school, by mentorship. You can get these skills from just doing short courses. These days, there are a lot of short courses online. So you can go online, learn all these skills. And then by the time you start your enterprise, then you are equipped. So what are we saying? There are many things that you can do in pharmacy. The pharmaceutical world is big, and the pharmacists are still very few. Actually, the pharmaceutical skill is still a scarce skill. So we just need to position ourselves, and we just need to equip ourselves with the right skills and be very focused on how my career path to be. If you decide you want to develop your career or you become an entrepreneur in the community pharmacy, know all what it takes to go into that career. If you decide you are going to do consultancy, then you decide in what field, then get the important skills in that. So if you do that and you are systematic and you are patient and you are consistent, you practice ethically, you are good to your clients, I can assure you, the entrepreneurial journey can be very exciting. It can be fulfilling because you are there making decisions about your business, but persistence and continuous learning is very, very important. So for me, my parting shot is that we need to have an open mind while working in this field. You need to identify the pain points that the industry stakeholders are facing on a daily basis. It's only after pinpointing that, then you come up with the idea of how you are going to solve that problem and how you are going to scale it up. The reason I'm talking about this is because we have seen, and my friend here will say, many situations whereby some of us just think just by going and starting a pharmacy next door, because Nahil is very successful, we're gonna go and do the same. But he's going to tell us that is not the way. We just need to have our very unique way and a very unique offering to the society. And if you give a good service, a service that the society needs. And as a pharmacist, you equip yourself. I can assure you are going to be successful. If you are not in your own business, where you go work, become an intrapreneur there. Go and create ideas there. And this is how you are going to. As positive as we step out, let's equip ourselves with the important skills, and we are going to thank ourselves that we burnt the midnight oil, learning about those very many chemical reactions. I think PharmChem used to be one of those subjects that used to give us reference. Guys, it's the same, but it will be worth all the while. So at the end of the day, once you do that, you also take time to enjoy your life. There is myself at the top of Mount Kenya. I love climbing mountains, and not just the real mountains, but the many mountains that are there in life. And you too can do that. Very much. I really wish all the students the best. And when you come out here, if you need any advice, those of us who have been in the field for long, we will be there to give you guidance and any support that you may require. Back to you, Prof. Thank you very much.
Okay, thank you, Dr. Thank you. Thank you for that. I just hope that that you were able to pick the key aspects. What you need to keep learning. We give you a lot of technical, okay, that we give you a lot of pharmaceutical skills, but in order to be successful, you need to keep learning. Learning doesn't stop. That is why my dear friend is now doing her second master. So we need skills in how am I going to manage this business? So learning will not stop. Okay. So I wish to thank Dr. Kamau for that talk. Please hold on to your questions. We will take questions after all the speakers have spoken. So be prepared with your questions. So without much ado, I want to invite Dr. Nahil to make his presentation and to tell us about his journey in vision and entrepreneurship.
Thank you very much, Faith. Yes, I would like to share in the practice of pharmacy that I've gathered over almost 30 years of practice now. There's somebody who has a slide presentation I sent this afternoon. If you could put it on the screen so that we can share it.
All right, working on it.
Okay. What I'm going to talk about is changing trends in community pharmacy practice. Now, the reason I'm going to talk about it, about emerging trends in community pharmacy practice, pharmacists today, unfortunately, have become irrelevant in that practice space, in the patient-facing practice space across the country. When I was a small child and we used to get sick, our father and our mother used to take us to a pharmacy where you see a pharmacist who you would go to first, and they would usually sort you out, and if they couldn't, they'll tell you, okay, take them to such and such a doctor, and then they will sort you out. But you people, you are the young generation of pharmacists who are about to come out into the practicing space. You will realize that your predecessors, I think our lot was one of the last ones that managed to sell the profession down the tubes and actually lose it this particular space. And the reason being that if you look today, in pharmacy practice across Kenya, only 105 community pharmacy practices that are actually run by pharmacists out of Kenyan pharmacy practice. The largest pharmaceutical chains, like for example, Good Life, does not have a single pharmacist actually practicing pharmacy on the pharmacy floor. And that is because whereas our predecessors were busy in the back offices juggling finances and being entrepreneurs, pharmaceutical technologists were actually patient facing, and as a result the expectation from a pharmacy by the Kenyan public deteriorated to a point that now they only expect you to be able to dispense, give some rudimentary advice, and give out medication. In fact, it's also ingrained in the minds of young pharmacists, because I've had the occasion to train about 30 interns in my practices. And one of my last interns actually told me that I don't think I can learn anything from a community pharmacy practitioner, because I don't really think I'm going to ever go dispense dawa. And I actually, I was a bit taken aback that he was so forward and he was so, forthcoming. But I thought he did not want to waste his time, and he thought that practicing community pharmacy is just an enterprise where you sell medicine over the counter and you count a few pills, and it's beneath his dignity to practice, to dispense, because that is the preserve of pharmaceutical technologies. And because the general public in Kenya actually expect pharmacy practice to be about giving you discounts and counting the medicine and packing it and giving it to you, and writing a few labels here and there, 1 times 3, meza kabla ya kuamka, and things like those. So we lost our space, and the respect that, you see, you can only be recognized as a pharmacist, as a doctor of pharmacy, and respected by the community if they recognize. We are not recognized anymore. So it's the public, when they come in, they don't recognize that you're a pharmacist. And there's a difference between you and the farm tech who is practicing his profession wherever he is, in his retail outlet. So when I actually decided to start pharmacy practice 12 years after I entered the field. I initially decided that I wanted to bring down the cost of medication, number one, and number two, create access to medication in Kenya. So I was actually inspired to go into that line because I went to do my internship in 1994 at the New Nyanza Provincial General Hospital. At that time it was called Russia. And my boss was Dr. Rai, who was also a community pharmacy practitioner, so he would rarely ever come. And my actual boss was the sweeper. It was Josie. Josie had the keys of the pharmacy, and he had the keys of the store. And when you entered the pharmacy, you found a clean pharmacy with no medicine, nothing. And so my job was to come in with a newspaper, open a window, and be patient facing. But my job was simply to say out of stock, out of stock. And I quickly learned the Luo word for it. So my job was to open the window and say, onge, 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 and then the poor patient would have to go outside and look for the drugs just outside, where there are a horde of pharmacies, chemists in kiosks outside the hospital. I realized at that point that the life of a child in Kisumu at that time was valued at 3 bob, because that's what ORS would cost. But the ORS that would come in would not be given to the children because it was being misplaced somewhere. I don't know where it was going, but it was not there. And so a lot of children died because of tree bomb. So I decided that initially I will practice my profession by going to India and getting good quality generic products which are low in cost that people can afford. And we did succeed. And then in 2012, when Dr. Jerusha will tell you that there was a change from homegrown regulatory processes where drugs were registered according to the Kenyan dossier to something called the Common Technical Dossier, which actually changed the system of registering medication to the European standards. And there were two things there. There's something called um, a CEP, and then there is something called bioequivalent studies. Or so that CEP or drug master file is for APIs that have been vetted and actually put through quality checks to make sure that it is conforming as per the standards that is being guided by. And so the CEP or the master drug files are not available with most manufacturers. And so if you are to continue importing medicines from factories which cannot comply because they cannot get API from single source suppliers, then you would not succeed in that line. But Dr. Jerusha, actually, you should talk to her about this. And I'm very sure she has a very lengthy story about how this changeover took place and how pharmacists found space. And that was a change that gave pharmacists space to actually start consulting for regulatory affairs, because it was the first time in the history of Kenya where nobody could just sit at a desk and start typing stuff, and or a factory in India start typing stuff and come up with a dossier that would even see the light of day here. Now it's only pharmacists who can do it, and that too pharmacists who are very well experienced and mentored, or pharmacists who have actually gone through extra training to actually be able to cater to the regulatory needs of product. So when that chapter ended, I decided rather than going into shady shenanigans and doing quasi-legal stuff, I just stopped importing medication and went to practice community pharmacy. And I was told that Nivasha is where every pharmacist who ever went there failed and came out broke. So I decided to go there and open shop and see why people are getting broke, because I had a theory that if a pharmacist practices pharmacy the way he's supposed to practice, or she's supposed to practice pharmacy, then there is no way you will not be respected by the community. And 10 years down the line, I had all the awards. Actually, the Gala Awards are awards given to the best healthcare professional in Nevasha. And there is a panel, Foster, that comes down from Nairobi and actually does vetting by taking samples of random general public and asking who is the best in this category. And for 4 years running, there was a Bishop Wambugu whose trophy was a floating trophy for the best healthcare professional, which we got as Exeter Pharmacy in Nahil, Dr. Dave. And they decided that trophy can no longer be floating, so they actually awarded it to me last year. And then Good Life was following me to buy, so I sold out to them, and then I came to Diani. And I think that was the testimony to the success of a pharmacy practicing pharmacy in his space or her space. Because truth be told, this is our space. So the reason you will never ever have to compete with pharmaceutical technologists or quacks is what we are going to talk about in the next few minutes, and that is the emerging trend in community pharmacy practice. So let's look at our preamble. So all other cadres have been able to acquire licenses to operate retail chemists, which are perceived to be by the general population to be the same as community pharmacists, and I've explained this. We have lost touch with our communities and the general public, so we are not recognized anymore. Next slide, please. Veterinary product and agrochemicals were the preserve of pharmacy, but there is now fights going on by veterinary boards and agrochemical characters, and everybody is turning up and taking bits and pieces of pharmacy practice. So now veterinary products and agrochemicals are a very small component or a zero component of pharmacy practice. And so we have lost that space in practice. That's one thing we have lost. Maybe you can go to the next slide, please. Yes, there was a big component of pharmacy practice that was the sale of perfumes, cosmetics, and toiletries, which is now actually been taken over by professional cosmetic stores and supermarkets, where price is the mainstay of what clients are looking for. I am talking to you while I am at my pharmacy and I have a client out there. So I request for 5 minutes so that I can close up. In the meanwhile, maybe Faith, can I just take 5 minutes and then I'm back on this discussion and I'll take up from this slide. Thank you.
That was very unexpected, but we can take this opportunity. Please feel free to ask Dr. Jerusha about her experience as a regulatory affairs pharmacist. I have some questions for her, but I feel it's only fair that they come from the floor. Yeah. If you're not able to unmute, please write on the chat. She's here for you today. Please fill the questions.
Problem unakatika, can't hear you clearly. I think the internet may be not good.
Okay, so I wish to request, I hope you can hear me now.
Yes,
so please,
you can.
Okay, so please, everybody, take this opportunity to ask Dr. Kamau about her experience as an entrepreneur and how she got that training as a regulatory affairs pharmacist. If you have any question, please feel free to field questions now. So over to you. If you can't unmute, you can write on the chat. Yeah. Okay, so I think I'll field the first question. So over to you, Dr. Kamau.
Yes.
Do you feel the regulatory affairs field can get saturated? Are there a lot of opportunities there?
Thank you, Faith. Thank you, Professor. So the regulatory affairs space, I think it is what entrepreneurs would call blue ocean, in that just as Davy has said, these regulations are coming into effect at a lightning speed. Every other time we are getting regulations coming into effect. And so what we need to do is to ensure that we get the right skills. Regulatory affairs space is not saturated. Actually, if you check, it's on LinkedIn. After every almost 2 days, you'll see a job on regulatory affairs. But the most frustrating thing is they say they need experience. And so somebody asked me, so Dr. Jerusha, now where do I get this experience? That is where now being very proactive in deciding I need to get the skills is very, very important. And when we go, especially to the industries, please let us be very keen on their regulatory affairs department. Most of the pharmacists start their regulatory careers from the industries. So the regulatory affairs space is not saturated. It's not likely to be saturated soon, Prof. Okay, I can see in the chat, there are some questions in the chat. What course can one take to run on medical regulatory field? Yes, a good question. One, you can take a foundational course, even like a postgraduate course, to understand regulatory affairs, but you can also go and work with a regulatory affairs specialist to run the skills. I think just when I came here, I already said that after practicing community pharmacy for almost 12 years, I went back to be trained on regulatory affairs. I actually went for attachment for 3 months to run regulatory affairs. So basically, it's by working with the people who are practicing that. And the next question is, what kind of courses? Okay, let me see that. What kind of courses? I think there was a question there. Let me just see. What kind of courses can one take to get into consultancy, entrepreneurship in future, while still in undergraduate? Okay, so I have already talked about, you can do a very rudimentary course in postgraduate in regulatory affairs. It will give you a foundation. I actually did that. And the next thing is to work with people who are already practicing regulatory affairs. And definitely in entrepreneurship, you can read books, you can do short courses on entrepreneurship, and also you can get mentorship from people who are already engaged in entrepreneurship. It really helps because you need these skills to be able to move to the next stage of entrepreneurship. The next question is, how do you position yourself in fields such as medical writing and e-health, where not many pharmacists have explored? Yes, this is a very good question. And that's what I said, you need to have an open mind. Of course, you need to read a lot so that you can identify what people need. The deal lies in identifying what the people need and coming up with a suitable solution to meet that need. So just you read, you listen to people's experiences, you listen to people's problems, and think, what niche can I focus on in this field? Back to you, Faith.
Okay, so about skills in medical writing and e-health, there's an online course. It's offered by an agency. It's called Clean Skills. Okay, what I'll do is that I will share the link to their website. You can do that course. It's a course that takes, they have many short courses, but each short course takes about 3 months. So they have courses in medical writing and also like in pharmacovigilance and all the like, yeah? So you can get a certification so that you can become a medical writer, and also regulatory affairs. So I share that link with Shannon later. Tell her to follow up with me. A second useful resource is LinkedIn. Yeah, so LinkedIn is a very good place where you can get jobs, and there are special groups. Let us say, like for regulatory affairs, pharmacists. These days, you don't need to have. You can work online. So as soon as you graduate, what I advise people is that when you're doing internship, save, and then that money, use it to upskill. Yeah. Then you have to be very, very intentional. Like Dr. Jerusha said, don't just drift. Yeah. Even before you graduate, if you've decided I'm going to become a medical writer, you have to be obsessed about that. Remember, Dr. Jerusha talked about being focused. I always tell people, be focused to the point of being obsessed. Yeah. And don't rush for money that, oh, don't think that, oh, I'm a medical writer. I expect to get a lot of money today. That is not going to happen. Yeah. So that is where you can get those skills. Become very good at navigating LinkedIn. So the next question, I can see Jerusha Dongo has asked a question. It's directed at Dr. Kamau. She has asked, what does consultancy entail? What are the branches of consultancy that you can do? So over to you, Dr. Kamau. You're muted. You're muted. You're muted. Please unmute.
Yes.
Please unmute.
So,
okay.
Thank you. So what does consultancy entail? You need to have the knowledge, first of all. As a consultant, you have to project yourself as an expert. So you must know the stuff of your the subject that you are consulting in. So we are not going to stop talking about please upskill, read and read about what you need to do. And about the branches, I think there are many branches in pharmacy that you can do. Currently, what is really there is you can do quality assurance, you can do regulatory affairs, you can do pharmacovigilance, you can do medication management. Actually, you can sell that as a service. I know a few pharmacists who are toxicologists, consultants, and they are very niche areas. So you just need to have an open mind and read more around that. We have a few oncologist pharmacists who are actually consulting in several hospitals. So be intentional and get focused, then get the skills in the area that you are interested in. And the world is still evolving. We don't know what tomorrow will bring. So let us be very updated on what the pharmacy field what is happening in the field, and spot the opportunities that are there. Then we meet the needs at that particular time. Thank you, Professor Faith.
Okay, I also wish to add, I think it's a big advantage to do a master's in whatever area, because in the process of writing a proposal, all those things, you start learning how to think critically. You can never become a good medical writer if you have never written a thesis, and if you've never had some lecturers like myself on myself on your neck. Yeah. So you need people on your neck. Yeah. So I wish to ask Charlene Odera to respond to I mean, can you respond to the question, to the comment by Charlene Odera before we continue? Okay, let me respond to that comment. I think, but do you find pharmacovigilance financially rewarding? Allow me not to ask that, to answer. There's a lady who offers consultancy services in pharmacovigilance. Her name is Dr. Madenge Koi Madenge. If you wish, I could invite her. She can tell you about consultancy services in pharmacovigilance. But let me allow Dr. Jerusha to make a comment because she's currently doing a master's in pharmacovigilance in Europe. So she's not a small lady, so you can see she's actually going to be one of our top specialists in pharmacovigilance. Over to you, Dr. Kamau.
Thank you, Professor Faith. Okay, so this sounds subtle, but do you find pharmacovigilance financially rewarding? Actually, Prof, currently we are almost doing more than 70% of our work is based on pharmacovigilance. We are doing less regulatory work than pharmacovigilance, so we are in that space. And for Shireen, I can tell you, apart from just the financial rewards, which really is subjective, about financial rewarding, it's really subjective. But in terms of you are ensuring patient safety, and we have a lot of guidelines coming into this space, so there are a lot of opportunities there. And what does it mean? When we talk about entrepreneurship, there is something we call rare resources. When a resource is rare, it's likely to be highly priced, okay? So if you are good at pharmacovigilance, and we keep on saying, be good at what you are doing, then you are going to have good financial rewarding. And maybe that could explain why I decided now I need to do my master's in pharmacovigilance and pharmacoepidemiology, because you need to be that expert in the field. That is a rare resource that people will look for, and when they look for you, they will compensate you well. Thank you.
Okay, I can see Dr. Nahil has joined us. So we'll suspend the question and answer session, and I will give the floor over to Dr. Nahil. Thank you.
Yeah, so if you can just go back to our slides. So next one, next slide. Okay, yes, next slide, please. So those two foregoing slides were just showing what we are losing out on, what's leaching away from pharmacy practice. And in this light, it's important for us to differentiate ourselves from other cadres purporting to practice community pharmacy, because there are no clear levels of practice that exist between various service providers. So we can complain till the cows come home and say, look, let the regulators decide at what level does a pharmacist practice, at what level does a farm tech then come in, and in all these things. But if you practice at your level yourself, based on your knowledge and your ability, then like Dr. Jerusha was just saying, you are a rare resource and you don't know it, but you are. And you'll realize that you have a lot more to offer to the Kenyan consumer than what a pharmaceutical technologist or anybody else has to offer. And so we have to now start looking at services that we can give based on our training as pharmacists that would differentiate us from the rest of the crowd, including our colleagues, the farm techs. Next slide, please. So it's very important for us to understand the ambit of our practice. What is the scope of community pharmacy practice? What is the ability? What is within the ambit of the qualification of a pharmacist as opposed to a pharmaceutical technologist? And are we just supposed to be a retail dispensing outfit, or are we supposed to be a pharmaceutical care center? Next slide, please. So for me personally, over the past 12 to 15 years, I've actually incorporated the following services within my practice. And in Diani, I'm no longer practicing as a community pharmacy practice. I'm practicing as a level 2 pharmacy, which is a skilled pharmacist, is an advanced pharmacist, because I have acquired a few skills along the way, which I'll describe to you as we go along. And so what I'm running is called a community care practice. I mean, a pharmaceutical care practice. So, and when you start practicing as a pharmacist and you step into the clinical space and start looking at the patient and not at the product as what you are dealing with, primarily, the product comes as a secondary thing. You'll get a lot of appreciation from patients and a lot of referrals from other cadres who are trying to dispense pharmaceuticals to people. So let's do the next slide, please. So these are some of the extra services that we give as pharmacists. Wound care. We find very many wounds are become chronic, and a lot of them are because there are diabetics, there are alcoholics, there are people with venous leg ulcers, secondary to varicose veins and things like those. And those wounds don't heal simply because the underlying conditions are not looked at. And then because underlying conditions, including perfusion of oxygen into the and blood into the extremities, where the wounds, where chronic wounds are usually found, are not being addressed, then we find that treatment failures are quite regular. Quite a high percentage of these wounds don't heal very quickly and don't heal for a long time. So when pharmacists step in, you find that just using effective wound management techniques on the pharmacy floor, and I've written a whole paper on this. I've done a whole presentation on this in several different fora, where I've shown success in wound management for pharmacists at the pharmacy floor. Then there's vaccination services. A lot of people in our generation, I know that you guys are orientated clinically and you know how to give intramuscular and subcutaneous and even intravenous injections. But in our lots of pharmacies, we were never ever interested in getting into the clinical space and actually go and do injections and do vaccinations. So I think Professor Faith Okalembo and myself, I think we were even mentored a little bit Professor Guantai on how to give injections at that time when we were vaccinology. And yeah, and I think we actually had to overcome that fear of touching patients, of injecting patients, of actually giving clinical care to patients. So if you look at America, if you look at South Africa, if you look at Australia, if you look at the UK now, 80 to 90% of vaccinations and elective vaccines are given on the floor. Not to line up in a hospital setting to go. But it's a different picture where medical allow you this because they simply say that that is their preserve and they don't want to lose it. Then medication therapy management consultations. You don't have to. I understand that everybody feels that you should have an additional master's and an additional whatever for you to do medication therapy management consultancy services. That's bullshit. There is a level. I'm sorry. I should talk with more decorum. That is not true. Scratch the other one. That is not true. So basically, as a qualified pharmacist, you already know, like let's pick hypertension, for example. You already know at what point in the hypertensive process each category of medication works. You know where the beta blockers work, you know where the calcium channel blockers work, you know where the ACE inhibitors work, you know where the ARBs work, and you can assess a patient who is on medication for hypertension and it's failing. You know how diuretics work, you know what are the side effects of diuretics, you know what are the special conditions, you know that there are very many patients in this country with chronic diseases which are comorbid, like hypertension and diabetes and dyslipidemia, all combined in one jumble. And you find the biggest mistake that medical practitioners make, and they don't believe that they do, is that they combine diabetogenic medications uh, in their comorbid diabetes cases. And so as a result, you find that we get poor glycemic control but good hypertensive control. So as a practitioner of pharmacy, without even having gone for medication therapy management services to a particular level, you can start giving those services. Now remember, there are experts who have done their masters and who are qualified beyond us, because I've never done a master's and I don't think I'll ever do one. But that does not mean that we are not knowledgeable, and that leaves room for us to practice at our level. So for those who are like me, who don't want to sit in a classroom through their life, I mean, it's admirable what Faith and Dr. Kamau and everybody is doing, but that's not my cup of tea. I would like to practice pharmacy. That's my passion, and I would like to do it every day. And I learn on the job, so I develop skills. So if you look at the American system where you get the PharmD, that is not a PhD. That is not heading you towards a master's or a PhD. That is heading you towards skill sets, developing competencies. And there are very many programs in this country where you can develop competencies, and the Pharmacy and Poisons Board recognizes those competencies, and they actually elevate you to the status of an advanced pharmacist, not as a master's, but as an advanced pharmacist, where you can give some of these services by virtue of your experience and your uplifted competencies by doing those courses, where you can get a little bit more in-depth knowledge of these things. So if you feel that you are not the sort of person who has the opportunity or the inclination to still now, after finishing this set of education, this education cycle, and then now go back into masters and other things, don't feel shy of looking at your colleagues who are planning to be PhDs and who are planning to do masters and other things and go into various higher level of learnings, and feel that you are that there must be something wrong with you. It's not true. If you wish to practice, you can practice and make a very big difference for your community. It just depends on what you're passionate about. I'm passionate about looking after my community, and personally I don't think that a master's or a PhD or a professorship for that matter would help me do what I can do for my community, because my community needs me to be a general practitioner, not a subspecialized in one small aspect of medicine or pharmacy. So you can do MTM generally, and you'll find that a lot of diabetogenic drugs are used in hypertensives with comorbid diabetes, and we can actually correct it, change it. And if anybody comes and wants to spend some time at our pharmacy, I'll actually show you a patient's journey before they came to the pharmacy and after, when we started monitoring, changing medication, and working together with their primary healthcare provider or their physician, and actually working together as a team to change medication which are ineffective, ill-advised, basically contraindicated in that situation, and things like those, so that we can actually come up with good positive clinical outcomes faster, and we do rational drug use, and we manage the patients correctly. That's medication therapy management for you. You know, big words are good, but you have to understand what you're doing. So long as you got the fundamentals right, you're good to go. And that Professor Demo will tell you every day of the week if you listen to what he's saying. Okay, then there is chronic disease monitoring. I'll show you an example of what this is. There are people who are using medicines on a daily basis. A lot of them are demented. A lot of them do not understand what medicine is supposed to be taken when, and they have to have caregivers give them this. So we have to monitor the disease outcomes vis-a-vis the fifth point, medication use and monitoring and reconciliation. So we have to do drug audits to check whether our patient is complying or is non-compliant, and how do we use the resources that we have around us in our pharmacy setting to actually make sure that we are getting proper compliance through a third party, because there's somebody else giving the dose. Then conversion of solid dosage forms to liquids. We have all made extemporaneous preparations, but we are restricted. We usually restrict ourselves to adding a few powders to some creams or ointments, and then we make salicylic acid and hydrocortisone, and then we give to the patient to rub on their skin. But we can actually make a bigger difference by changing solid dosage forms into liquids, which we think you need a hood for, and you need to have specialized technologies. You don't, you can do it on the pharmacy floor. And there are things which I'll show you in the next few slides that you can use, which are pre-made, that you can actually convert practically any tablet into a liquid and help patients, which we've been doing for over 12 years now. Family planning services are also within your preserve. You can give family planning consultations, help ladies make correct choices, and choices that they will not regret 2 weeks or 2 years down the road. And then there is diagnosis and treatment of minor ailments, and together with that comes a referral, when to refer and what to touch. When you ask a pharmaceutical technologist about cough, they'll say that when a patient comes in, ask the patient, what kind of cough do you have, a dry cough or a wet cough? And if the patient happens to say dry, give a suppressant. If the patient happens to say wet, then you say take an expectorant. And if the patient says I'm wheezing, then you give them something combined with a beta agonist. That's all. That's all not correct. That is very, very terrible way of practicing, because you are looking at patient's subjective opinion of what's going on. You don't lay a finger on the patient and voila, like some magician, you know exactly what's wrong with this person, and then you start treating them. So that is subjective assessment of patient based on patient opinion, and then there is objective assessment, which we can dwell into if Professor Faith wants us to talk about those aspects. Then we can come and actually talk about uh, how to change your practice from subjective management to objective assessment and treatment and good referrals, knowing when to refer and knowing when to treat. Okay, so let's go to the next slide, please. That is wound care. Next. That is vaccination services. That is my vaccinology certificate there. And we actually train people through Kansas to Kenya with Professor Guantai and also Faith and myself. And then there is Dr. Nadia, and there's a huge team. There are very many people who are in this, and a lot of them are your teachers. And I think also all of you should try and enroll into this, because this puts you on a firm footing to be able to qualify as a primary healthcare provider. That brings you this plus a little bit of training in MTM and a little bit of training, not to master's level, and a little bit of training in family planning, and you can become a advanced pharmacist. Next, that is MTM consultations. I actually have my files like this for Exeter Pharmacy. We actually talk about medicines, and a lot of them are just incorrect frequencies or inappropriate techniques. Like I used to get a lot of clients would come in with inhalers, and they're using the highest dose inhaled corticosteroid, and they are puffing away, and they are still uncontrolled asthmatics. So the moment you start changing those techniques, Stanley, give me a few more minutes. I'll be done just now, and then we can talk. We can answer your question. And so, just by introducing a spacer device and showing a proper technique, then people start getting controlled. In same way, some techniques of subcutaneous injection using even the simple insulins can be uh, done wrong and give you inadequate results. And so just inappropriate techniques can be addressed in this. Next slide, please. Yeah, chronic disease monitoring. I have developed a system on my own, how to manage, how to monitor patients, and how to do that. When the patient is going to see their physician, we can give them a one pager that would give them all the information on one page to look at in an Excel format, so that the doctor can know what's been happening, how the patient has been behaving, what interventions we made at the pharmacy level, and what is the clinical outcome. A happier patient, well controlled, so that the doctor focus, the physician can focus more on now checking the liver health, the kidney health, and other aspects of hypertension that have to be monitored by physicians on a periodic basis. The physicians here are usually left firefighting because pharmacists are not available, pharm techs are giving medicines, and there's no pharmacy practitioner who's actually a pharmacist who is intervening and saying, no, 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 we need these things changed. So that by the time the patient goes to the for a review to the physician, the clinical picture is very good for the hypertension, even if there's comorbid diabetes. And the physician can focus now on making sure that the organs and other uh, deteriorations are not taking place, because some of these chronic diseases are progressive. So can also make sure that progression of disease is not taking place. Next, please. That is a way to do monitoring and reconciliation of medicine. It's a very simple thing. When you look at all these patients who come after a stroke or are half conscious, some of them are not able to coordinate their thoughts, and all of patient which is between 30 and 50,000 a month, and the family is buying this medicine. The patient is usually semi-ambulatory and being looked after, usually not a family member, including medicated by those guys. And if you typically look at this picture, that patient will deteriorate slowly and gradually until they become comatose and then they pass away. Usually the period is between 2 years and 5 years, and the quality of life deteriorates as the patient goes through this process. And one of the biggest reasons is non-compliance in medicine use. So the patient rarely gains strength and keeps deteriorating. So when we use these systems that we have that when I use this system that I have developed, I find that my patients get better, they get stronger, and they start going out, at least sitting in the garden, having their tea by themselves and enjoying even going to church. Some of them have started going to church on Sundays. Not saying that you become normal like everybody else, but at least you start enjoying your life a little bit more. Next, that flavor blend 2-in-1 is a beautiful thing that the Americans have made, which allows you as a pharmacist to provide a solution for an ailing baby without having to send them to Mater Hospital or Nairobi Hospital. You are doing something for them to say that they are the only people who all the headache of blend with perfect dosage without variances. And with this little bit of equipment, just very simple equipment, you can actually convert solids to liquids. Yes, next. Yes, that's the family planning aspect. You can actually advise on which ones to use and why, and then make the correct decisions. Next. Minor ailments. I'll talk to you about this guy on the, he's on my right, so he's probably on your left. This is actually a gentleman, is some white between the lower and the upper jaw, which we have taken up and turned out to be suboral mucosal fibrosis, and that is a precancer because this gentleman was chewing a lot of tobacco, and so I referred him to his dentist when he was going to India, and they found that it was almost entering cancerous stage. They did a few surgeries and they got rid of it. And that is actually the power of a pharmacist, looking in your mouth and seeing what's going on and being able to recognize that something is not right, yeah, and being able to give you a correct referral. And that young lady there has something called pityriasis vesicola, because it is changing the color. And we actually pick up things like this, know how to identify, and when we can do that and understand the therapy, the chemotherapeutics, and then you can just actually manage such minor ailments within the ambit of your profession without referrals. Next, please. That's me for you. I would encourage as many questions as you can ask, and I'm here to answer. Thank you.
Okay, I think I was very impressed by the good work that Dr. Nahil is doing. You can see why I invited him because of innovation, entrepreneurship, and innovation. So he's actually using his skills. He's branching into areas that people do not typically think they can do within the ambit of pharmacy practice. And he has been very, very successful. You can imagine winning an award continuously for 4 years, and even you beat medical doctors. So, I hope you're all inspired. What I want the take-home message to be that when you go out there and you open your retail pharmacy, what can you do differently that other people are not doing? Okay, so I can see there are a number of questions. So I'll go by seniority. I will start with Professor Stanley Ndwiga, and then we can go over to Nelson Kioko. So Dr. Ndwiga, please take the floor. Thank you.
Thank you so much, Professor Kalebo. And thank you so much, Dr. Nahil Dave. Of course, you not remember me because I was younger than you, but this talk has been very, very good. At the same time, I also want to say to Dr. Jerusha, I think what you have shared is quite, I think, eye-opener for our students and young ones. And since I going straight to the points I want to pass across, there's something that Nahil has just said towards the end of his talk. The power of a pharmacist. And the power of a pharmacist, many of us or the generations ahead have not been able to fully take it to be able to implement changes in the profession as they should be. For him, Nahil has already done the work in vaccinology and his practice. You can see he's not acting like Okalaburu was saying this. is not acting like the evangelical pastors. Because I tell pharmacy students, we as pharmacists, you should stop working and behaving like pastors. When I'm a pharmacist, my wife becomes a pharmacist. Because you see evangelical pastor, the wife is a pastor. Eh? So you need to hold our profession as what it's supposed to be. And I thank you, Nahil, for that statement. That one nobody should forget. Then there's something you also mentioned about clinical doctorate. And this one, if you have clinical doctorate services, I know in Kenyatta National Hospital, the people who have done clinical pharmacy, they actually charge for their services. You not be able to be a pharmacist to go and open a pharmacy to make money. So you go and consult a patient, and as medics are charging, you also charge. That's gonna be the next level. Then the next thing, because I want to take as short time as possible, I want us pharmacists to be able to turn people's lives around. Eh? And for me, I've been inspired by my experience in the COVID era. And I can tell you, my students, I can see the secretary, I think is there, Mugisa. For me, at one point, I almost lost faith in medical practice because everything which was bringing hope, it was fought. But I will not, I realized I cannot give up. So what's my experience? We needed to also tell people that what is new is not always better. And I use two examples. Dr. Nahil when he graduated, and also Dr. Kamau when he graduated. The medicine which used to be there was Rivaroxaban. It was me marketing as Vioxx. And people are being told to abandon it so they can take abandon diclofenac for Rivaroxaban. It killed many people. And it was with the drone. So you have Rivaroxaban. At the same time, I won't even condemn Pfizer because Pfizer also developed Ferrodin or Broxcam. So it's not about the company and the other things. And finally, we think about drugs like cimetidine, Tagamet, which was the drug of choice when I was a student, which as AstraZeneca was replaced the ranitidine and people made the money. So pharmacists make money based on their science and everything else. So what's my point today? Today, I'm happy that we have got young people listening to experienced colleagues like Dr. Jerusha, Dr. Nahil, and Prof. Kalebo. You are the person who was keynote in establishing pharmacovigilance as a course. Pharmacovigilance, it's so key to me because I want side effects of drugs to be discussed the same way we discuss the goodness of medications. And more importantly, people are asking about careers. How can you get careers in the pharmacy? Because I don't want people to give up. And I can tell you, I can confess, my son is doing pharmacy because I believe in the pharmacy. So as we look ahead, let us open our minds, learn from the experts, and Dr. Mdave, Dr. Jerusha, they can continue mentoring our young people so they can realize that pharmacy has even a bigger future. Don't be discouraged. Me, the only message I'll pass today, pharmacy students, don't be discouraged. The future, we are there to work with you, and there are people out there who will work with you. And remember, the people tell you that the climate change and all those other things, the future is better than it was. There's no good old days. Because as I finish, Dr. Nahil Ndave can tell you as was cabinet to become, I think I was still cabinet to become a treasurer of Nupsa, if I remember in Chiroma those days and as a student, 1993 or 94. There were no mobile phones when it come in person. There was no internet. We used to go to Chiroma to research, but much has changed. The same way, so much has changed in the pharmacy profession. Open your minds and look clearly ahead. There's so much. And thank you for the people who have come to join us in this talk. Thank you, Dr. Nahil and Dr. Jerusha, for speaking to our students and mentoring them. I'm grateful, and that's what I will say today. Prof. Kalepo, thanks for this. I'll always be joining. Thank you. Back to you, Prof.
Okay, thank you, Professor Ndwiga, for those very kind words. I hope they have inspired people. Okay, so I will ask in order. Okay, I gave Professor Ndwiga preference because of seniority, but the first person to raise a question was Nelson Kioko, followed by Shannon, and then Miral. So we'll take questions in that order. So I will read Nelson's Kyoko's question. So what is your take on a pharmacist involvement in traditional African medicine? I don't know, I wouldn't wish to answer that question. I wish to ask first our panelists, also with Dr. Ndwiga, if we can answer, because I don't want to dominate the floor.
If I may say, if I may contribute, I don't think that as pharmacists we should ignore traditional African medicine, because most of the modern day breakthroughs actually come from herbs and from plant material, and a lot of them come out of Africa. The only problem is that our traditional healers have typically never been able to patent their finds, simply because the West does not recognize plant material which has not been purified to a certain extent as intellectual property, right? There's a big fight which one has been always fought between pharmacognosists and the intellectual property rights people, the KIPI guys. So I think that if we are to have a holistic practice of pharmacy and offer solutions to problems, illnesses within our country, we must be very much aware of traditional African medicine. In fact, I have just been talking to some Americans, believe it, in Kitale, who are talking about a herb concoction that somebody makes there, that they are actually using to reduce prostate inflammation, benign prostate hypertrophy. And there are patients who are using those concoctions and nothing else, and are actually doing very, very well on it. But when it takes an American to come recognize the potential of African herbal medication and actually start making it more understandable, trying to standardize dosages and trying to understand what is contained in it, then we are going to start losing out as Kenyans. We must take hold of that, and it's a very important component of our practice. Thank you.
Okay, I also wish, sorry. Okay, I also wish to add, there is a pharmacist, he's called Dr. Maina. He's practicing as a herbalist. His premise is very, very modern. He's actually based in Hurlingham. I have not been in touch with him for long, but if you really wish to visit his practice, for those who might be interested, please contact I will work through your chair, that is Shannon, and I could probably take five or six people to his practice if you're interested. So he's a trained pharmacist with a herbal practice. Yeah. So Dr. Jerusha, you wanted to say something?
Okay, thank you, Faith. So what I would say is that about traditional herbal medicine is part of medical care. We cannot ignore it. And of late, we have seen even the regulator looping in those products, because the problem with that, it has been that field has been unregulated. And so we have seen patients' life being endangered because we have all kinds of people practicing. But if we have trained practitioners, practitioners, we have products which are standardized and regulated, then it is a very good branch of medicine. So we have seen the regulators bringing on board those products so that they can look at their safety before they are released into the market. And so, yes, it is not wrong to get involved. It's just that we need to ensure the products we are dealing with are safe and within the regulated space. Back to you, Prof.
Okay. Thank you, Dr. Kamau. Now I would like to give Mujisha Shannon a chance to field her comments.
Thank you, Prof. Mine is more of a request based on an experience. So during my 4th year attachment break, we had attachment initially, and then it was a bit of a break. So during that break, I got a chance to do an attachment at National Drug Authority, but in Uganda, because I'm Ugandan. So most holidays I go home. Yes, so mine is more of a request to the panelists and Prof. Okalebo and Dr. Ndwiga. Yes, in case there are any of these opportunities that students can do during, these breaks that they have in between the transition from the different levels of studies, feel free to send us emails, inbox us. As Nupsa, we are very willing to share with the students. And also to Dr. Dev, I interacted with Dr. Kamau, and he mentioned how it wasn't a walk in the park when he was starting his pharmacy, the very first branch. Yeah, so if you could enlighten us on maybe some difficulties that you faced during your journey and how you went about them briefly, because probably, it's quite an experience. But if you could briefly enlighten us on which particular areas gave you a hard time and how you went about them, that would really be of importance to us. Thank you.
Okay. Thank you, Shannon. Yes, of course, let me say, when you start a pharmacy, and Nahil will bear me witness, we always think that if you are a pharmacist and maybe you have seen a very successful pharmacist, you'll put up a premise and you'll be much successful. We always say that there is a lot of money in pharmacy, but when you get to practice, you realize, yes, you could be a very good pharmacist practitioner, but there are other things that you need to know. You need to know what kind of systems do I need to ensure that I control my stocks. You need to know what kind of systems do I put in so that I get the right people, because unlike many other practices in pharmacy, you can't work alone. You need to have maybe 2 or 3 assistants at least before you ask, however small you are. So my main challenge was when I realized I didn't have the necessary business skills. And so most of my processes were not working. And you lose stocks and you lose money and you get very, very discouraged. That is, I can see Nahil laughing. So that was one of the most discouraging things. And that could explain why at some point I felt I needed to go and learn about businesses. How can I run a good and successful business? So that was my main challenge. But maybe Nahil could share his experience.
Yeah, why not? I mean, I would love to share some experiences. So yes, it is important for you to know how to run a business. It's important for you to know how to manage your finances. That is very important. Here is the thing. When you want to start a retail outlet, when you want to do community pharmacy practice, the first thing you have to understand is that procurement, having stocks of medication, is not a walk in the park. You cannot just say that I'm going to buy from distributor A, B, or C. I will buy from Eldo, and then I'll get everything I want. And then I'll just be giving them the orders and they'll be giving me product. It doesn't work like that. there are a lot of companies you have to interact with, and you have to start to learn what is needed by your clientele, and all those things you will find are not sourced from one single source. You have to start learning these things. So if you're passionate about community pharmacy, I would suggest that you work at least for 2 years in a busy pharmacy setting and in a successful pharmacy setting where there is a pharmacist who is willing to hold your hand and guide you and expose you to everything. Then you'll actually start to know the supplier, who supplies, what does it mean when you buy from when you buy at a lower discount. What does it mean when your patients come and say that your prices are too bad, they are not going to buy from you. So you see, these are the realities. So if you have to learn the procurement process, it is actually a whole lesson on its own, which can never be taught anywhere. And Daktari will tell you that that this nobody can teach you. This you have to learn. You have run a retail outlet for so many years, and I'm sure you learn things that you never thought, which you and I both know can never be taught in a school. Okay, so there is no substitute for experience. So don't jump into this thinking that after I finish my internship and acquired my license, I can straight away go open outlet and start pharmacy. No. Learn on somebody else's coin. Make your mistakes on somebody else's coin, which means go get hold of Exita, get hold of Calm Pharmacy, get hold of Dr. Nadia, get hold of Dr. Jerusha if she still has an outlet somewhere, and tell her, look, if you are practicing, I would like to learn, and give me a salary. I don't mind if you give me 50K or 60K or whatever it is they are paying these days, because when we were qualified, private sector used to pay higher salaries than government. And I was paid, I think, 6,000 shillings by Ministry of Health. My first salary, 6 or 7,000, I think. Yes, you guys are given a much higher salary by government when you get jobs. But and private sector used to pay top dollar, but now it's all gone. Okay, so you have to look for space to practice. So what you really need to do is experience. There is nothing you need to do get experience, and you can get experience without losing money doing it. The only way you can do it is learning it from an employer who needs you to assist, and they are experienced. So you're learning those lessons by making mistakes where it's not going to hurt you in the pocket. And believe me, it is a wealth of experience that you really, really will need to start and succeed in pharmacy. Because let me tell you something, if you are working in a very competitive environment like Nairobi is the most competitive, I believe, you'll find that people are dealing with stolen goods, not only KEMSA, but goods stolen from people's warehouses. So there's those half-trade cargo businesses which are going on. Then there are the parallel imports. Then there are students all across the country, all across the world. There are students in Turkey who will come with a briefcase full of dawas from Turkey. There are students in Pakistan who do the same thing. There are students in India who do the same thing, and also Europe. So you will find students coming back with bagfuls of dawa just to pay for their air ticket, especially the ones who are in India and the ones who are in Turkey. And you'll find that you can actually make 5 times your investment. So if you put $1,000, you will get somebody to buy that medicine for $3,000 to $5,000. So your ticket expense going and coming for your holidays paid up. And there are people who are looking for those mules who are going to come with dawas. So it's a symbiosis. It happens. In fact, nowadays there's a cartel that anybody going to India is told, do you want us to pay $200 and then you bring for us madawa to Takupea? Huh? And then somebody will clear you from the customs. So, and you are a pharmacist, you did not go to school for 5 years, 6 years and do all this hard work to become a crook. I mean, if you wanted to become a crook, then it's very easy, isn't it? There's no point of even going through all these pharmacy school, learning ethics, learning patient care, giving a damn about supply chain and proper distribution practices, proper, dispensing practices, and all these things. The moment we start jumping supply chain, treating supply chain as a suggestion rather than as a necessity, a definitive. I mean, like for me, I'll give you an example. I actually call 5 suppliers on 5 different items and trace back batches to the manufacturer every week. But I can only do 5, random selection of everything that comes in. That gives me a sense of whether I'm getting product which is not uh, come from gray sources. It's only the white line supply chain. So all these experiences you will learn from somebody else. And the other thing that you need to learn is just because you have somebody giving you 5 million shillings because your family happens to be some wealthy cousins and wealthy aunties and uncles and father and mother, and somebody is willing to give you 5 million shillings to start the best pharmacy there is, believe me, if you don't know what you're doing in pharmacy practice, you are going to lose that 5 million. Am I right, Dr. Jerusha? I mean, you have to know this. So 2 to 3 years, learn from a busy pharmacy. You have to be passionate. And by the way, those 2 to 3 years, Professor Kalembo and everybody will tell you. So if your passion lies there, then do that. If your passion lies in community pharmacy, then get an apprenticeship and take that opportunity to actually better your skills by going for these short courses for vaccinology, for family planning, and it will actually buoy you up to do good pharmacy practice. Thank you.
Professor Faith, we can't hear you. You are muted.
Okay, I just want to add to what Dr. David said, is when people go in a business, you're very green, you don't have experience, there's a risk that you will lose all your money because you don't know how to manage the finances, you don't know how to detect fraud, you don't know how to pay taxes, and all those things. So if you can, please get mentorship. So Dr. Jerusha had offered a mentorship position, internship, but unfortunately, nobody took it up. So what I suggest that you do is that when you graduate, please look for a mentor whom you can work under, even if you're not getting much money. But the experience you will get is marvelous. You'll really get a lot of experience. Learn mistakes on somebody's premise, not on your premise. There's a question, and I hope the question asked by, okay, I don't know, I can't see my chat, but there is somebody who had asked a question related to people when they start opening a business, they don't get taken seriously. So the reason being is you lack experience. So please, when you graduate, look for a mentor, work under them. Yeah. Okay. So Suleiman has asked, how do you differentiate yourself? Exactly what David did. Yeah. Offer new services. It takes a lot of courage. Yeah. Like the vaccinology training. You just be different. Yeah, like I remember when I was when I was doing my internship, I just took an interest in, I would always check for drug interactions whenever a patient would come. And I found very many. So I would send the patient back to the doctor with a note. Then suddenly I started getting many telephone calls from the prescribers. They would call the pharmacy, I want to talk to Dr. Okalebo. Then they would ask me so many questions. It was something I had never expected. Yeah. So it takes a little bit of initiative. That is what entrepreneurship and innovation is all about. Doing things differently. The results will not come immediately, but they will come eventually. Yeah. So Ndwiga has his, sorry, I know I'm calling him Ndwiga, I should be calling him Professor. But so I wish to invite Ndwiga to make a comment because he's raised his hand up. And also, please, Dave, please follow up on what I've said. Yeah.
So very, very quick one. Actually, for me, I want to mention just two things from this conversation. I'm actually quite happy that you invited the two speakers for us. And I know both of them. At least Nahil may not remember me because he's older than I. But what he has explained here is quite important, because I think information is quite important, and also what to call formation. Because what formation people who can be able to offer services, not based on money, what you're earning or whatever, but you want to offer as a pharmacist. And in Mombasa, I know, apart from Lady Dave, there's a classmate of mine who was called Mutasa Mohamed Ali. I've seen him once from 1993. That 1 years ago. And I think maybe Dave, I think you must back with him. But there's a gentleman called also Dr. Jim Shangala, who was my classmate. So every time we have met, it's always about providing services for Kenyan people. It's not about that you as superior pharmacist or whatever. It's about services. And I think from this conversation you have had today with our students, you want the best service. Sijasikia Ndavi akisema ati pharmacist ati superior even nani, and I'm quite happy. Then number two, to finish from where I stand, we are supposed to work together to build this profession to be even to be a better place ahead of us. And the students were listening to me. Me, I am a person who is actually, apart from pharmacy work, I am a farmer. Yeah, so I do farming. I deal with people in whatever. I have no pharmacy, but when I look at the whole thing is that how can we be able to take over pharmacy practice to make it what it's supposed to be? And I came to realize we must have a paradigm shift so that the same way a medic passes through our hospital, seeing a patient, then he changes prescription, charges 10,000 shillings. I want pharmacists to do the same. And on that basis, I was appointed in 2020 to be the advocacy person for FIP, International Pharmacy Federation in Kenya, because they are trying to see how can you have a pharmacy recognized better in Africa, because Africa is whereby people think pharmacy are just shops with sell products, and yet you are selling poisons. We must work together, all of us. And as I finish this statement, the next two sentences, please, let's all of us think, how do we charge for our services? Because hata kama tunakata shamba prod ya eighth, he charges man 10,000 shilling or whatever. We need to charge for our services. That's how farmers are going to grow better. And then more importantly, is when now you find like Nahil Ndave, as he says his practices, he will not be there competing with the people who are just sellers. We are not renders. We are supposed to offer services because a lot of knowledge is about medications. So there's a lot of things to learn. Let these talks continue. And Prof, thanks for organizing this. Thanks, Nahil, for being there, and also Dr. Kamau, Jerusha. I like these talks because the more that we do them, we are going to change the profession of practice pharmacy in Kenya. Thank you so much, Prof. And I stop there. Thank you.
Thank you, Prof.
Thank you, Prof. Maybe just what I would like to add on top of that is that in life, value is in the eyes of the clients. So when you go out there to offer a service, ask yourself, if I was the one who was buying this service, would I pay for it? Would I find value in it? If you look at what Nahil is doing, if somebody is going to look at your prescription and deconstruct it and tell you, I think this medication is not working as it is because of this, you feel you have gotten value, and even when he charges, you'll be ready to pay. So when we go out there, let's ask ourselves, what value are we paying? Because the client will not want to know whether you are a pharmacist or a pharmaceutical technologist. They will look at the value of the service you are getting. So that's why we need to get the experience. That's why we need to get the skills. That's why we need to get focused. On the point of getting experience, I've seen a question on that. Let us be patient and be very intentional when we go to these premises, even when we start for internship. For me, I've seen some students who come for attachment and they behave like, because I'm not being paid, I will not work well. That attitude is not good. And when it is carried forward, it affects even what you can learn from even this very simple thing like the attachment. So having the values that you need to have, good work ethics, good in relationship with people, all will make you a whole person and to contribute towards your success in your endeavors, whether you are going for employment and whether you are going for entrepreneurship. It is very, very important. Thank you.
Thank you, Dr. Jerusha. Can I say one more thing here? Because I'm very much interested in Suleiman's question. How do you differentiate yourself? I'll tell you something. An experience, personal experience. I've been practicing pharmacy in Diani for 3 months now. 3 months. On Tuesday morning, I came to the pharmacy at about 8:30 in the morning to open. I found a gentleman who had come on holiday sitting outside the pharmacy. And I'm on the first floor. On the ground floor, there's a pharmaceutical technologist who is practicing pharmacy. And his pharmacy opens at 7 in the morning. So his pharmacy was there. And this guy is sitting outside my pharmacy on the first floor. So I opened the pharmacy and invited him in. And he told me, look, my wife is sick. And she has been diarrhea. And then I said, but there's a pharmacy downstairs. Why didn't you go there? He says, no, but you know what you are talking about, doctor. And for a guy who comes from Italy or from Europe to come and look at you and call you doctor, because they call their pharmacists Mr. in Europe. So for that guy to come in, say, no, but you know what you are doing, doctor. And these are the problems that I'm facing. And then we gave a consult, and then we actually got the medications that they needed and followed up on the patient, and she was fine. But that is differentiation. So Suleiman, you don't have to consciously differentiate. Do what you know best. Be you. Be the pharmacist. Believe tech is being a farm tech.
Yes.
Shamelessly is being a farm tech. And you should shamelessly be a pharmacist. And let me tell you, the skills that you are displaying when you are practicing as a pharmacist is not something that you are conscious of. It is the people around you who are getting impressed with, because you are offering them something way beyond what they have been experiencing in their community. Thank you.
Okay, I'll take one last question. We are actually beyond time, but I feel this discussion is very interesting. In fact, I feel bad to bring it to a close. Okay, given that questions are not forthcoming, I really want to appreciate Dave. Okay, I'm calling them by their first names because we learned together. It's not really good etiquette, but so please you'll excuse me. But I wish to thank my colleagues, that is Dr. Dave Nahil and Dr. Jerusha, because believe me, to spare time, even 2 hours, to spare this time to come and talk to people is not something that you should take for granted. And okay, and I really wish you would listen keenly to what they have said, because if I had received some of this advice, I would not have made some mistakes in my life. Yeah. So please listen to them, have a positive attitude, differentiate yourself. It's possible. They both have done that, and gain experience. Look for mentors. Even if you're being underpaid for 3 years, you have a lot to learn. Learning does not end in School of Pharmacy. You need to learn how to interact with people, even how to dress, etiquette, values. You need to learn that. Those are the things we can't teach you in farm school. You need to go and work under somebody who is experienced, who is successful. They will look at you once and they'll say, this person needs to be taught A, B, C, D. Humble yourself and learn from people who are better than you. Okay. So I think there's something on the chat. It's a word of thank you from Suleiman. And I feel bad I have to bring this discussion to a close. And I wish to request Shannon to make a closing remark.
Thank you, Prof. Yes, on behalf of Nupsa and all the students, we'd like to thank the panelists, Dr. Dev and Dr. Jerusha. We'd like to also thank Professor Okalebo and Professor Ndwiga for making time to mentor us and give us words of advice. We really appreciate this. Speaking on behalf of the students as well, we'd like to encourage more of these opportunities, and we are really interested in getting to know more about pharmacy practice and any other opportunities in general. And I'd also like to leave the students with some advice. We actually had a class with Dr. Mutai, and she mentioned in Swahili, jitume. Yes, so make sure, you do your best in whatever aspect that you have been given the opportunity to serve in, even if it's as little as, you think maybe it's beneath you in quotes, or it's something that you actually really wanted, make sure you do your best at it. Yes, with that, I would like to officially close this webinar and thank the students for making time to listen in.
Okay. Thank you, everybody. Good night and God bless all of you. Asante sana.
Good night
Thank
too.
you.
All the best.
Thank you. Bye-bye. All the
Bye-bye.
best.
Okay, bye.
Bye.
Bye, everyone.